Hello everyone, I'm Anas Al-Ubaidi, and the topic for this session or this lecture is about integrated patient cases for clinical medical scribes within chapter 26, which is about the chapter is about review of family medicine and outpatient scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Integrated patient cases serve as a vital educational tool in the advanced training of clinical medical scribes. They simulate real world scenarios that require scribes to meticulously gather, interpret, and document patient information across diverse and often complex clinical environments. Unlike isolated lessons or medical terminology or differential diagnoses, integrated patient cases provide a comprehensive framework for understanding patient care as a dynamic and multifaceted process. This enables scribes to continue meaningfully to healthcare teams by ensuring that all interactions are documented with precision, clarity, and depth. The role of a clinical scribe extends beyond mere transcription. It demands a keen understanding of critical thinking, problem solving, and the ability to synthesize information from multiple sources, such as patient interviews, provider assessments, diagnostic tests, and treatment plans. Integrated patient cases embody these challenges by presenting scribes with situations that require careful attention to detail and context. As for example, in managing a case of chronic illness exacerbation, the scribes must document ongoing symptoms, identify the impact of concurrent medical issues, and record a timeline of past and present treatments. Such cases not only refine documentation skills but also sharpen the scribe's ability to anticipate the needs of the healthcare provider, enhancing the overall quality of patient care. Furthermore, integrated patient cases train scribes to distinguish between clinically relevant details and non-essential information, a crucial skill in the fast-paced environment of healthcare. A single patient encounter might involve multiple specialists and intricate histories and nuanced updates, such as a medication adjustment or a new symptom presenting after diagnostic intervention. Scribes must ensure that all pertinent data is captured accurately, presented logically, and maintained in a format that supports continuity of care. Such precision is critical to preventing errors, enhancing communication between providers, and ensuring that patient outcomes remain the central focus of clinical efforts. The importance of these cases lies in their ability to simulate complexity while maintaining a controlled learning environment. This approach helps scribes build confidence in handling multifaceted scenarios, such as documenting acute emergency visits, managing patients transitioning between primary and specialty care, and supporting physicians during comprehensive annual exams. By integrating patient cases into training, scribes are better prepared to adapt to diverse clinical settings, including outpatient clinics, urgent care centers, and specialized practices. The key points: critical thinking in integrated patient cases, enhancing analytical skills. Integrated patient cases are designed to cultivate critical thinking among medical scribes by providing them with multifaceted clinical scenarios. These cases replicate real life complexities where scribes must evaluate and document critical decisions made by healthcare providers or clinicians. Analytical skills are sharpened as scribes interpret how symptoms, findings, and treatments interplay in patient care. Example: a patient presents with chest pain and a history of diabetes. The scribe documents the physician's differential diagnosis, which includes angina, gastroesophageal reflux disease, GERD, and musculoskeletal causes. The scribe also tracks key observations like EKG, ECG results, or lab findings, aligning them with the most relevant diagnosis. And here is a diagram summarizing how to document critical decisions in patient care, as we have angina, musculoskeletal causes, and GERD. Anticipating provider needs. Scribes must actively listen and anticipate the informational needs of physicians to stay ahead in documenting the patient's story efficiently. Integrated cases often include subtle details that require scribes to predict which data the provider will need next. Example, as for instance, during a complex patient encounter, the provider orders a cardiac panel after observing abnormal ECG readings. The scribe proactively references the patient's past cardiovascular history and enters relevant findings into the chart. And here is a summarized diagram summarizing the art of anticipating provider needs. On the left, anticipating provider needs. On the right, we have active listening, predicting data needs, efficient documentation, integrated case details. Mastering documentation skills, accuracy in capturing information. Integrated patient cases focus on training scribes to balance accuracy with the speed. Comprehensive documentation includes recording not only the patient's subjective complaints but also key data points acquired through diagnostic tests, provider observations, and consultations. As for example, for a patient undergoing evaluation for chronic kidney disease, the scribe meticulously records lab results such as serum creatinine and eGFR levels, along with physician or clinician commentary on disease progression and proposed treatment adjustments. Structuring clinical narratives. One major skill developed through integrated cases is the ability to organize sprawling amounts of data into concise and logical narratives. Scribes are trained to utilize templates like SOAP, subjective, objective, assessment, and plan, while personalizing notes for each unique case. Example, a scribe documents a SOAP note for a patient experiencing recurrent urinary tract infections, UTIs, ensuring the narrative highlights subjective symptoms, painful urination, objective findings, positive urine culture, and the provider's or the clinician's plan, antibiotics, and specialist referral. Synthesizing information from multiple sources, coordination of interdisciplinary inputs. Modern healthcare involves multiple providers working together to deliver optimal patient care. Integrated patient cases prepare scribes to synthesize input from various professionals such as primary care physicians, specialists, physical therapists, and lab technicians. Example, a scribe manages the complex medical documentation for a diabetic patient transitioning from primary care to endocrinology follow-up. The case involves integrating recommendations on insulin therapy adjustments, dietary changes, and specialist feedback on complications during the same visit. Cross-referencing records. Integrated patient cases emphasize the importance of cross-referencing a patient's prior medical history, medications, lab results, and imaging studies to create a coherent record that supports accurate clinical decision-making. Example, for instance, before a consultation, the scribe reviews and integrates relevant details, including a history of high cholesterol, current lipid levels, and previous medication trial outcomes into the patient's chart for the cholesterol management visit. Supporting healthcare teams through documentation, streamlining provider workload. Integrated cases highlight scribes' role in alleviating physician burden by handling real-time documentation. This allows the provider to focus on patient care while relying on scribes to track critical steps. Example, while the physician assesses a patient with suspected pneumonia, the scribe ensures accurate documentation of symptom onset. Physical examination findings, crackles in the right lung, and all test orders, chest X-ray, and CBC, complete blood count. Ensuring regulatory compliance, medical scribes must document encounters in compliance with legal standards and institutional requirements. Integrated cases explore scenarios that require precise coding, billing support, and adherence to privacy laws under HIPAA, as for instance in USA. Example, a scribe documents the time and exact actions taken when managing complex patient case involving post-surgery follow-ups. The detailed notes ensure Compliance with the evaluation and management, E/M, evaluation and management, coding requirements. Improving communication among providers or clinicians, scribes play a key role in bridging communication gaps within multidisciplinary teams. Integrated patient cases teach scribes how to document in a way that promotes seamless internal referrals, follow-ups, and care transitions. Example, a patient with uncontrolled hypertension is referred to a neurologist for further evaluation. The scribe ensures that the primary providers or clinicians notes comprehensively detail earlier observations like persistent high blood pressure for the specialist to utilize in subsequent uh, care. Managing complex clinical scenarios, multi-system case documentation, integrated cases often feature patients presenting with overlapping conditions, requiring scribes to prioritize what is most relevant to the current visit while preserving context for continuity of care. Example, a diabetic patient presents with acute foot pain and fever, which the physician or the clinician suspects as a case of diabetic foot ulcer. The scribe documents the infection-focused findings while cross-referencing the patient's overall diabetic management plan. Learning through simulated complexity, integrated cases serve as realistic training models, preparing scribes for fast-changing scenarios like emergencies or high-pressure outpatient visits. This hands-on approach builds confidence and adaptability. As for example, a simulated case involves a patient with cardiac arrest in an emergency setting, the scribe is trained to rapidly capture actions like CPR initiation, medication administration, and the physician's step-by-step management decisions in real time. Next, we have the summary tables. Here we have table on elements of critical thinking in integrated patient cases, component description, example, importance, challenge. Components, we have differential diagnosis, evidence correlation, anticipating care needs, context interpretation, and prioritization of data. Table on key documentation skills for complex cases, skill description, example, benefit, risk of neglect, skills, we have real-time note-taking, structuring, templates, contextual adaptability, terminology precision, consistency, and chronology. Table on synthesizing information from multiple sources, source, role in documentation, example, importance, challenge. Sources, we have patient history, diagnostic results, specialist notes, medication profiles, lab results. Table on supporting healthcare teams through documentation, as we have contribution, description, example, impact, challenge. Contributions, we have communication support, reducing administrative burdens, handoff preparation, quality assurance, billing, and coding accuracy. Table on key challenges in managing integrated patient cases, challenge description, example, impact, mitigation strategy. Challenges, we have data overload, errors in cross-references, time constraints, information prioritization, adaptability to cases. Next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. What is the primary role of a medical scribe when handling integrated patient cases? A. Providing diagnosis and treatment plans for patients. B. Ensuring all clinically relevant details are accurately documented in real time. C. Conducting physical exam alongside the physician. Or D. Replacing the role of administrative staff in clinical operations. It is B, as the answer is B, as scribes are responsible for capturing key details during patient encounters, ensuring the documentation is accurate and complete. This supports the physician or the clinician in delivering proper care while maintaining compliance with organizational and legal standards. Question 2. Why is synthesizing information from multiple sources critical in integrated patient cases? A. It reduces the need for follow-up appointments by consolidating all findings into one visit. B. It ensures documentation aligns with treatment plans from multiple providers. C. It eliminates the need for diagnostic testing by relying solely on past records. Or D. It prevents interdisciplinary collaboration from influencing patient management. So answer is B, as it ensures documentation aligns with treatment plans from multiple providers, as integrated patient care often involves inputs from various specialists. Synthesizing this information ensures the care plan is cohesive and supports continuity, reducing the risk of conflicting treatments or missing critical details from prior evaluations. Question 3. How do scribes contribute to the prevention of errors in a multidisciplinary team settings? A. By independently correcting provider errors during documentation. B. By documenting consistent and comprehensive notes that minimize communication gaps. C. By making clinical decisions to expedite patient care. Or D. By reassigning tasks to other members of healthcare team. The answer is B, as by maintaining detailed and structured documentation, scribes promote clear communication within multidisciplinary teams, ensuring everyone is informed about the patient's condition, care plan, and ongoing treatment. Question 4. What is a key challenge scribes face when managing integrated patient cases, and how can it be addressed? A. Retraining patient confidentiality during interdisciplinary consultation solved by limiting updates. B. Managing excessive data from multiple sources resolved by prioritizing clinically relevant inputs. C. Maintaining independence in decision making solved by delegating documentation to providers. Or D. By balancing clinical and administrative tasks solved by reducing documentation completions. Answer is B, as integrated cases often involve vast amounts of information. Scribes must focus on the relevant clinical data to ensure that documentation is clear and actionable, which can be achieved by training in data prioritization and streamlining through EHR electronic health record technology. Question 5, which best exemplifies the role of a scribe in supporting regulatory compliance during integrated patient cases? A. Ensuring accurate time stamping of notes and adherence to billing codes. B. Providing direct feedback on treatment plans during patient encounters. C. Modifying the documentation to remove redundant information. Or D. Consolidating all patient input without aligning with HIPAA requirements. The answer is A. Ensuring accurate time stamping of notes and adherence to billing codes, as regulatory compliance requires precise documentation, including timestamps and appropriate billing codes, for example, CPT codes, as scribes play a critical role by ensuring that all encounter details support legal, financial, and institutional accountability. And here we come to the end of this lecture. Thank you very much, and goodbye.